The Asia-Pacific region has made tremendous progress towards the elimination of malaria. Some countries have already been certified as being malaria-free. Other countries are in the process. But to really achieve the full goal of malaria elimination by 2030, we need to redouble our efforts. And we need the contributions of all partners, government, civil society, private sector, technical partners, but also financial partners to achieve the final goal. And the only sustainable solution to malaria elimination is to do the job, because malaria will always come back if we do not succeed in eliminating it for good.
Excellencies, ladies and gentlemen, Indonesia stands firm in its commitment to eliminate malaria by 2030. Today, 79% of districts are malaria-free. We are stepping up detection and treatment to reach districts still at risk. To accelerate progress, we launched the Indonesia's Call to End Malaria. This initiative brings together sectors, resources, and partners to focus on high-burden areas. We are strengthening cooperations with neighboring countries and global partners to improve health systems, advance research, and ensure sustainable financing. We value strong partnership with APLMA, the Global Fund, Gavi, the private sector, and others, including communities, technical experts, and civil society. We call for continued regional collaborations and shared commitment to protect our people and build a malaria-free Asia-Pacific. Thank you.
Malaria leaders across the Asia-Pacific region have brought us closer than ever to elimination. Your work has saved lives from the Mekong to Timor-Leste to the Philippines and the Pacific. The Global Fund has been your partner in the Asia-Pacific, backing national plans, studying what works, and helping reduce malaria deaths. But the threat is growing. Climate, resistance, and funding gaps put progress at risk. With the 8th replenishment of the Global Fund ahead, your leadership and advocacy are vital. Together, we can finish this fight for good.
One big factor for RISE's success is its regional collaborative approach between committed leadership from governments, academics, donors, private sector partners, communities and civil society. This success is built on the dedicated network of over 35,000 community volunteers and workers, providing malaria services in the communities they know best. To ensure no one is left behind, communities lead the way in the fight against malaria with equity and inclusiveness.
Malaria hits others among women, children, people in poverty, indigenous groups, migrants, and those with disabilities. Communities already facing barriers to healthcare due to discrimination and inequality.
The climate crisis makes this worse. straining health systems and deepening poverty and poor sanitation, raising the risk of severe malaria. To fight malaria effectively, we must break down these barriers with inclusive, rights-based and gender-sensitive health responses.
As one world, one fight, we need a fully resourced eighth replenishment of the Global Fund with at least $18 billion to support the implementation and scale up of essential malaria, TB, and HIV services, which will help to save $23 million.
Fulfill the global health commitment for malaria elimination by 2030 by enhancing the domestic resources to scale up the diagnostic, preventive, and curative services in malaria endemic countries, and close the funding gap of $478 million in Asia Pacific.
Reignite immediate funding for research and development of new anti-malaria technologies to combat the threats of drug and insecticide resistance, as well as more effective vaccines, and strengthen health and community system to accelerate the path towards UOC, and reinforce preparedness against future threats, including pandemics, antimicrobial resistance, and climate change.